Good morning, Danny. It's really exciting to see you here today at Congress 2025. And the work that we do together, I think thanks to the World Stroke Organization with the grant that they've given us in Nigeria, where I'm focusing on building capacity of healthcare professionals on stroke rehabilitation. I think that this has given us opportunity to train a lot of healthcare professionals. Do you know, when we got started, we did a survey to know how many of the doctors, neurologists, physiotherapists, nurses have had training in stroke care. And we found that 64% have not had any formal training in stroke care prior to this study. So we are grateful to the World Stroke Organization. We conducted a hybrid training. Some of the participants were on site and some were online. And the study was across 3 study sites, 2 in the southwest geopolitical zone and 1 in the southeast geopolitical zone, because we have 6 geopolitical zones in Nigeria. Okay. But the 2 zones are just about 15 minutes drive from each other, so it was convenient. Mm-hmm. We recruited 203 participants and designed a curriculum to cover the trajectory of stroke care, from awareness to prevention to acute stroke care, rehabilitation, life after stroke. And we engaged WHO personnel, specialists and other specialities to do the training. It was really fantastic.
No, that is fantastic. Thank you, Rita. Yeah. And it sounds like you've identified a clear need, and with the support of WSO, been able to address it. Could you tell us a bit more about the outcomes of the training, and what you've learnt from the training, and what you think is next in terms of training healthcare workers in stroke awareness and care in Nigeria?
Excellent. So the major and most excellent outcome we have is that the curriculum that we developed has been adopted by the World Stroke Academy. So it's now online as the African Stroke Initiative Program. So that's what it's called. But do you know, over 2,000 people across the world have accessed the training module and downloaded their certificates.
Fantastic.
That's exciting.
No, it's really impressive numbers. It's great to see. Yeah. And can you tell us a bit more? You also work on life after stroke. You have a model of care for life after stroke. Yes. Can you tell us a bit more about what that model is?
Fantastic. So for our study, we did a pre-post data collection. And what we wanted to see is to know whether the training they had impacted on rehabilitation. This hospital have 5-bed stroke units, which is very expensive, and most of the stroke survivors are admitted to the general medical ward. So we created a life after stroke center, which is modeled after the Stroke Action Nigeria Life After Stroke Center model, where we have an area, a clinic for prevention, awareness, psychosocial support, rehabilitation. We have a fully furnished gym, so that patients from within the hospital and those that are discharged to the community, and not only discharged from the hospital of study, but hospitals across the area, come in for their rehabilitation and support for life after stroke. So we focus on things like, secondary prevention, regaining mobility, speech, and returning back to work, integrating back into the community. So that's really great for us.
Fantastic, and great to hear it's becoming a referral hub for not only the main hospital, but the surrounding hospitals. Can you tell me a bit more, who's involved in running that clinic? What kind of staff are needed to run a Life After Stroke Centre?
Fantastic. So the model that we developed in Stroke Action came from my research as a MERZ scholar in the UK. So I conducted a study on the role of the nurse in stroke care, and the outcome was community-based Life After Stroke Center. We are very keen that in low-resource settings, like in Nigeria, we don't have a lot of neurologists, neither do we have stroke units. We don't have a lot of physiotherapists and speech therapists. In my region, in the southeast, there's no speech therapist at all. So we trained and developed what we call stroke ambassadors. And the stroke ambassadors can be healthcare professionals, other professionals, lay people, stroke survivors that are recovered, or the carers. So we train them and transfer the skill for secondary prevention, for exercise, rehabilitation, supported conversation, and so on. So they are the people. For this particular study site, from the research, we are able to select 4 people to work in the Life After Stroke Center. 2 nurses in the stroke unit, working part-time, because it's only open for about 2 days now. We have an activity coordinator and an admin, and we've trained them as stroke ambassadors. And from the research, we'll pay them for 1 year, and the hospital will take over.
Okay, fantastic.
Yeah.
And I guess many of us will be more familiar with, I guess, kind of physiotherapy clinics and more traditional rehab and medical. But it sounds like you do a few more activities which are beyond the standard physiotherapy, beyond the standard medical.
Yes, well, we collaborated with the physiotherapy department to have a physiotherapy stroke ambassador, and we pay him 1 day a week, to support the stroke ambassadors in the Life After Stroke Center. So that's what we've done.
No, great. And perhaps you could reflect a little bit on where you would like the Life After Stroke centres to go. Understand perhaps that in your setting patients have problems in terms of accessing care, right? You're paying for transport, getting to the centre. I don't know if you could talk about problems that people might have in terms of accessing, but also how you would like to grow the programme or adapt the programme to increase access and uptake of this intervention.
Yes. You've really touched the point here. The main challenge and limitation is access to transport. So you find that it's stroke survivors that are either admitted to hospital, they are medically fit for discharge, but staying in hospital for one reason or the other, or those that are admitted to other wards like surgical, and stroke survivors that live around the locality that can easily access the service. That's the major problem, okay? However, we are working with collaborators to see whether they can fund replication of the Life After Stroke Center in other areas. And we've been fortunate. So we are going to set up one in the in National Hospital Abuja in the Federal Capital Territory, one at the University of Nigeria Teaching Hospital, and one in Onitsha. So we're hoping that this is the way we're going to, create impact and have more Life After Stroke centers in a region without stroke units.
No, that's fantastic to hear the regional spread and the diffusion of this. Yeah. And I hope one day you might even go international.
We have, because we are in Malawi now, and we're going to Rwanda and Uganda with support of our collaborators. Thank you.
Wonderful. Very impressive.
Thank you.
Congratulations on all the work, Rita.
Well done. So, can you tell me about your own project and what you're doing with the support you got from the funders?
Sure. Thanks, Rita. So I began working in Sierra Leone in 2014, and the last 5 or 6 years we've been trying to improve stroke services. And Sierra Leone is a low-income country in West Africa, so it's a little bit poorer than Nigeria, and we have perhaps similar challenges but exacerbated. So at the moment in the country we only have one very distinguished but retired neurologist. We do not have a speech and language therapist in country, nor an occupational therapist. But we do have a committed team. And so we began the journey by, just like you, by doing research, by trying to understand the scope of the problem, understand who stroke was affecting, understand what care they were receiving. So we began a stroke register in the capital, Freetown, and that looked at the care and the type of stroke that around 1,000 patients were having. And we saw that actually the mortality was very high. So there was a high in-hospital mortality and there was a high mortality at 1 year. We also noticed that our stroke patients were very young. So the average age of our stroke patients was 59 years.
Wow.
So maybe 15 years younger than we would typically see in Western Europe. And that the stroke severity was extremely high. So these were young people having very severe strokes with significant disability and significant death caused by stroke. And we then went on to look at their quality of life. right? So talking to these individuals themselves to see how was stroke affecting them up to 1 year and 2 years post-stroke. And we began to learn some of the barriers they have in accessing care, their experiences of care, and then we worked with the Ministry of Health.
Fantastic.
And so in 2020, the Ministry of Health launched a non-communicable disease strategic plan.
Fantastic.
And they committed to the establishment of stroke units in Sierra Leone, so at the main, in the capital and at the main regional hospitals. And so we got behind the Ministry of Health and we provided some of the support, some of the technical advice to develop those stroke units, as per the plan. So in 2021, we sent a team of multidisciplinary team from Sierra Leone to Ghana, to Korle-Bu Hospital, where they have a very good stroke unit, and they trained under Professor Akpalu.
Yeah.
And when they came back, they began to implement stroke unit-based care. So since 2021, so almost 4 or 5 years now.
Fantastic.
That stroke unit's been up and running. Yes. It's a 10-bed unit, and we've seen around 1,000 patients who have come through there.
Fantastic.
Yeah.
Yeah, very well done. I think it's really exciting to see how you have gone from developing a stroke register to the outcomes from that informing service developments. And that is exciting.
Yeah.
Now, can you tell me a little bit more on how you think that the study can help you to further reduce the burden of stroke in Sierra Leone?
Yeah, for sure. So as you say, we can use data to inform how we deliver our services. We can then use data to inform how we improve our services.
Yes.
Right? So we can now show that actually patients who get admitted to the stroke unit rather than the medical wards, they have much lower rates of aspiration pneumonia, they have much higher prescription of secondary prevention medications, and a better outcome.
Fantastic.
Right? So this intervention, as it does in many parts of the world, is reducing disability and reducing death for people with stroke in Sierra Leone. But I think without the initial data to describe the problem and then the ongoing monitoring, that's what motivates people, keeps people accountable, and can help us drive change for our patients. And the ministry also wants to expand stroke units further.
Yeah.
So in 2023, we set up the first regional stroke unit at Kenema Government Hospital. And that, although it's a smaller unit, we're starting to see increased patient throughput and hopefully more patients receiving evidence-based care.
Fantastic. Well done. Well done. I noticed, well, in Africa, we know that we have more stroke incidents. And your particular age is about in the 50s, people that are in their most economically active lifespan. So most of them will probably not be able to return to employment or need some work re-engineering. So how do you think, what's the next step in terms of social participation, for these people and returning back to work?
Yeah, no, fantastic. So what I've described to you has been the program for acute care.
Yes.
Right, and we really hope that over the next couple of years, and with support from WSO, we'll be able to start working on rehabilitation and return to work.
Yes.
So we're looking at a few different interventions on how we can support patients post-discharge, how we can support access to physiotherapy, how we can be more targeted in what are the needs of these patients, especially looking around spasticity and function post-stroke and whether we can improve our interventions to prevent spasticity and pain.
Yeah.
In terms of participation and return to work, I think the first thing that would be wonderful for Sierra Leone is to have an occupational therapist.
Fantastic.
So we would love
to have one employed.
We would love to connect with anybody who can support OT training in the country, because I think having skilled professionals who know how to do that well is critical to moving that forward.
Absolutely.
But we also look forward to learning from your initiatives, from learning what works in the Nigerian and now the Malawian context, and seeing whether we can translate that into actions in Sierra Leone.
That would be fantastic, and I think it's a proposal we can approach the WSO with and see where we can go from there. So many congratulations to you and your team. We're very proud of you, and thank you.
Wonderful. Thank you, Rita.